Hi everyone, my name is Aditya Turi. I'm a second year Brown IM resident. I'll be leading these sub-I lectures via podcast. I thought I'd start us off with a quick orientation regarding our lecture series and what to expect coming ahead. So, just quickly about me. So, I'm not a nameless, faceless dude lecturing at you. Like I said, I'm a second year. I'm about to become a third year in July here at Brown. I graduated med school in 2017 from Geisinger Commonwealth School of Medicine, located in good old Scranton, Pennsylvania. And before you ask, yes, I am very familiar with the office, well versed in the office, love the office. Know all the locations that they talk about in the office. However, I'm originally from New Jersey, and if you find me geeking out hardcore incoming lectures about hemonc topics, it's because that's what I hopefully intend to someday do when I grow up. I'm also particularly invested in medical education. Love to see our med students succeed, which led me to participating in the clinician educator track here at Brown. And lo and behold, this is one of the core tenets of my project for that track. So, enough about me. Three quick disclaimers about our lecture series here. These lectures are not in any way, shape, or form reflective of the content that you're going to find on the IM shelf, step 2 or 3, or the internal medicine boards. They're very limited in scope in terms of the actual medical content, so I would not use these to succeed. And hopefully using better material to succeed on those exams. The second disclaimer I have for you is our sub-I experiences certainly will vary team to team. Your residents and attendings are really going to drive the show with regard to the actual individual experiences you all have. My hope is that this lecture series gives you the core tools that will help assist you in dealing with different types of experiences, regardless of the actual individual day-to-day experience. And finally, these lectures assume that you have already successfully completed your third year medicine clerkship, congratulations, and are ready to start your fourth year sub-Is. All of our lectures are going to have learning objectives. This lecture is no different. We have 3 in particular I hope to work through today. The first is going to be looking at your role on our medical teams and understanding the learner landscape, where you fall in regards to other learners on the team. So we're going to help differentiate between the third year and the sub-I. The second thing is I want you to understand the scope of these lectures and how they're actually going to help you going forward, and what these lectures will and won't do, and how you're going to use them going forward. The third and final learning objective I have for us is to walk through 4 core skills that I hope will define and frame all of our lectures coming up. So before that, let's talk about what a sub-I actually is, or some other places may refer to them as an acting intern or an acting internship. So, strictly speaking, sub-Is are medical students in their 4th year, and they are provided an opportunity that's based around the idea of progressive graded responsibility. So congratulations, you made it through third year, and now we're going to give you a little bit more responsibility based on your relative experience compared to your third year colleagues. And the hope is that through this month, you're going to develop the skills to successfully transition to intern year and be rock stars in your early months as an intern. So that's our hope for all of you. But so like, what do you actually do that's different when you look at what you did as a third year? This is not just an extension of your third year clerkship. This is supposed to be an entirely different experience. So the way I look at the two is that in third year, you're really running around trying to gather facts. You are collecting a bunch of items, whether it be information from your patients, synthesizing or collecting different lab results, imaging results, looking through consultant notes, trying to understand what everyone's talking about with regard to any given patient. And certainly you're dealing with fewer numbers of patients. But then I look at the 4th year sub-internship as kind of a building on that initial kind of process. So if third year is this scavenger hunt where you're finding all these facts and figures, and you may not necessarily know what to exactly do with them, the fourth year sub internship is the time for you to build and synthesize all of those facts and figures that you've obtained about your patients. So you've gone around collecting all these wonderful, colorful, intricate Legos. You're ready to build this wonderful cityscape, which I would not have been able to accomplish back when playing with Legos was acceptable, and probably still wouldn't be able to today. So the fourth year sub internship really is for you to build and synthesize your medical fact finding into something that's going to affect patient care. You are beginning the road to becoming a physician in that you are going to actually take care of patients in your fourth year and start making some of these decisions independently. But wait, so you just sat through a year of lectures, and I'm about to give you some more. Totally fair question. How's this going to help you? Believe me, as a fourth year medical student, I would have run away screaming from additional lectures, and I do not blame you if you feel the same at this very moment. My ultimate goal is simply two goals. The first goal is really to give you the tools to succeed in your sub-I experiences. And I think there are three different things that I'm really looking at to help you succeed in your experience. But the second goal I have is really to respect your time and effort. So if you invest in this process, if you invest in these lectures, my hope is that you're going to get the tools to help you out with these three things, which I think are going to be easing your comfort in terms of your actual rotation. A more comfortable student is a more successful student. The second thing is I'm hoping that these lectures are going to provide you with the tools to be more efficient, both helping you with team building. Your residents and attendings are going to love you if you know how to do some of these things already. The second thing is you're going to be able to get out on time and maybe enjoy a little bit of fourth year. That includes maybe doing more in terms of your applications and not being super stressed out at 4 p.m. Or in the latter half of fourth year, like chilling on a beach. So the hope is that you learn from these lectures tips and tricks to be more efficient going forward so that you can be successful in your sub-I. All right, guys. Certainly last but not least, the 4 core skills I alluded to earlier in the lecture. This is what I hope is going to define the framework of our sessions together. So these 4 core skills came from a committee of national program directors who sat down to address a really vexing problem in that they were getting interns of really variable skill sets. So they came up with these 4 skills that they then parlayed back to their counterparts in the fourth year to help sub-Is work on these items so that they could be much more effective interns by the time they transition to their intern year. So these are 4 skills that I'm hoping are going to be littered throughout our sessions together. You'll see that there are 4 kind of tiles laid out next to each of them. I'm hoping that these tiles will then kind of trigger you that we're working on these different skill sets as we're going forward, regardless of the lecture topic. So the first one I think is one that's completely integral to the first year. Most interns will tell you that this is the number 1 skill that they learn by the end of intern year, and it's recognizing sick versus non-sick patients. And this is a skill that I don't think needs to start developing as an intern. You can certainly work on this as a sub-I. So we're going to walk through different scenarios of patients that are sick and recognizing how to help them. The second core skill that we want to walk through together is knowing when to ask for assistance. We as a program and as a hospital system really are encouraging our interns to know when to ask for assistance. And I think that extends to our medical students, both third years and fourth years. Knowing your limits, knowing how to reach out and ask for assistance is always going to be super important, both for appropriate patient care and patient safety, but also just understanding your own personal limits and what you're able to do for a patient in the immediate sense. The third skill that I hope is going to translate the best out of probably all 4 of these to your intern year is learning effective time management. If you can really develop a great method for managing and rounding on patients in the inpatient setting, this is something that's going to follow you as an intern and hopefully ease your transition during a really stressful period of time. And the fourth, and probably the most underrated of these four core skills, is learning how to communicate effectively within your healthcare team. And that may mean the immediate definition of your fellow residents, attendings, other interns, other sub-interns. But I'd like to expand that definition to include nurses, case managers, outpatient providers, whether it's PCPs or subspecialists, but also family members. And understanding that that conversation will really change based on who you're speaking with. Know your audience is a core tenet to being an effective physician. So we're going to walk through different patient scenarios and understand how that conversation might change depending on who we're speaking with. So that's really the hope for these sessions together. Good luck this month. I really am invested in your success both this month and certainly going forward. If you have any questions about anything, feel free to reach out. That's my email address down below. You can also text me, page me, however you can get a hold of me. I'm happy to help and assist you in any way possible. Good luck this month, and I hope to see some of you out on the wards.